Hi, I'm Dr. Dan Sindelar, and I'd like to share with you some thoughts on oral cancer screening. It's a very important part of being a dentist. It is very important that we all address this. We are the managers of this part of the body, and it's up to us to go ahead and make sure that that's not a problem for patients, because it's a very deadly problem. Last year there were 36,000 new cases of oral cancer in this country, and quite a few die every year. We used to rely upon just looking. It was a visual thing. Now we have step-by-step systems that you can implement and incorporate into your practice and make sure that a patient isn't at risk. I would suggest screening every patient. And I know we do oral cancer exams historically, and we were taught that in dental school, but now we need to screen, and we need to screen in a much more high-tech way. There's a number of systems out. I personally like Veloscope, but I would strongly suggest go step by step. Number one, I would do an oral cancer screening. I would take health histories and elaborate on that, find out if they have any family history, find out if there are any risk factors that are over the top. Then I would also do the screening with something like the Veloscope, verify that there aren't any problems. If there are, then refer them out, unless you do that yourself, but I usually have the oral surgeons take care of things, or the ENTs. I've had numerous cases in my office that I found I would have never seen it. The patients weren't aware of it. So once you get to that point, then you have done the patient a great deed, and you're also helping them head things off, because this, more than any problem I know of in dentistry, is absolutely necessary to address it early. You keep it as a simple problem. If you miss it later on, it's a really big problem, and it could actually kill somebody. So once again, I would strongly suggest do an oral cancer screening, not just a visual look, but an actual screening with some of the systems that are available, and verify that there are no problems. I would do that on every patient, and you don't feel free to charge that out. That is something that you're doing as a service to your patients, and you will head off some really big problems for people and help them and help their lives.